Hello everyone, today we will talk about the pelvis and gluteal regions. My name is Leo and I will talk about some important osteological landmarks in these regions. The pelvis consists of the two hip bones, the sacrum and the coccyx. There are three parts to the hip bone. On the ilium we can find the anterior superior iliac spine and the anterior inferior iliac spine. We can see that the ischium and pubis come together to form the obturator foramen, and on the ischium we can find the ischial spine and tuberosity. Additionally, the sacrospinous and sacrotuberous ligaments make the greater and lesser sciatic notches into the greater and lesser sciatic foramina. In this image, we can see the head of the femur articulating with the pelvis at the acetabulum. Some osteological landmarks are the greater and lesser trochanters. On the posterior aspect, we can find the intertrochanteric crest, the quadritubercle, and lastly, the gluteal tuberosity. On the tibia, a landmark of interest is the lateral tibial condyle. The gluteal lines are important osteological ridges that separate the muscles that will be discussed in the next few slides. These are from superficial to deep, gluteus maximus, medius, and minimus. We have the posterior gluteal line in green, the anterior in yellow, and the inferior in blue. Lastly, an osteological landmark depicted in this posterior view of the pelvis is the sacrum.
My name is Monica and I'm going to be discussing the next few slides. Gluteus maximus originates on the sacrotuberous ligament, the sacrum, and the ilium posterior to the posterior gluteal line. Gluteus maximus travels distally and laterally to insert on the gluteal tuberosity of the femur. Additionally, gluteus maximus meets and travels with the iliotibial tract to insert on the lateral condyle of the tibia. The inferior gluteal nerve and artery supply innervation and blood, respectively, to gluteus maximus. Deep to gluteus maximus is gluteus medius, which originates on the ilium between the anterior and posterior gluteal lines. Gluteus medius then travels distally and slightly laterally to insert on the lateral aspect of the greater trochanter of the femur. The superior gluteal nerve and arteries supply innervation and blood, respectively, to gluteus medius. Deep to gluteus medius is gluteus minimus, which originates on the ilium between the anterior and inferior gluteal lines. Gluteus minimus travels distally and laterally to insert on the anterior aspect of the greater trochanter of the femur. Gluteus minimus has the same innervation and blood supply as gluteus medius, seen in the previous slide, which was the superior gluteal nerve and arteries, respectively.
Hi, my name is Dana, and if we look at this lateral view of the thigh, we can see the muscle tensor fascia lata, which originates at the anterior superior iliac spine and iliac crest, and inserts via the iliotibial tract, which is an elongated strip of fascia, to the lateral condyle of the tibia. Tensor fascia lata is innervated by the superior gluteal nerve and receives blood supply from the lateral circumflex femoral artery. Looking at the superior view of the pelvic floor, we see piriformis, which originates on the sacrum anteriorly, travels distally through the greater sciatic foramen to insert on the superior border of the greater trochanter of the femur. Piriformis is innervated by anterior rami of spinal nerves S1 and S2 of the sacral plexus and gets blood supply primarily from the inferior gluteal artery. Here we see obturator internus, which originates on the pelvic aspect of the obturator membrane and surrounding pelvic bones and travels posteriorly through the lesser sciatic foramen before inserting on the medial aspect of the greater trochanter of the femur. This muscle is innervated and supplied blood by the obturator nerve and artery. Obturator externus, found deep to the cut portions of the anterior and medial thigh muscles, originates on the anterior aspect of the obturator membrane and surrounding pelvic bones and travel laterally to insert on the inferior aspect of the greater trochanter. Obturator externus, is similarly to obturator internus, is innervated and supplied blood by the obturator nerve and artery.
Hello, my name is Parmita and I'll be going through the remaining muscles of this presentation. Superior gemellus is originated on the ischial spine. It's inserted on the greater trochanter of femur on the medial surface. Its actions are the same as inferior gemellus, which are lateral rotation of femur, abduction of femur, and stabilizing the hip joint. It's innervated by nerve to obturator internus, and the blood is supplied by branches of the inferior gluteal artery. Inferior gemellus is originated on the ischial tuberosity. It's also inserted on the greater trochanter of femur on the medial surface. It's innervated by nerve to quadratus femoris, and the blood is supplied by branches of the inferior gluteal artery. Quadratus femoris is originated on the ischial tuberosity on the lateral border. It's inserted on the intertrochanteric crest of femur, and the actions are lateral rotation of femur and stabilizing the hip joint. It's innervated by nerve to quadratus femoris, and the blood supply is by medial circumflex femoral artery. These three muscles that I mentioned, as well as piriformis, obturator internus, and externus, form the 6 small lateral rotators of the femur. And that concludes our presentation. Thank you so much for listening.